Her hands moved before her mind gave permission. 3 seconds, one artery, one life hanging by a thread thinner than silk. The room went dead silent, not from relief, but from shock. Because what Anna Hayes just did was impossible. Not for a nurse, not for anyone without a decade in a surgical theater. The chief surgeon's coffee cup slipped from his fingers and shattered on the floor. His eyes locked on her hands. And in that moment, 6 years of hiding evaporated like smoke. If you've ever reinvented yourself to survive, this story is for you. Subscribe, follow along to the very end, and drop your city in the comments. I want to see how far this story travels. The trauma bay at Mercy General was never quiet, but tonight it was something else entirely. It was the kind of night that smells like copper and adrenaline, the kind that veterans of emergency medicine described later with a slow shake of the head and a 1,000-yard stare. 3 car accidents in 90 minutes. A construction worker with rebar through his shoulder. A teenager who'd coded twice and somehow kept fighting. The department was stretched so thin it was nearly transparent, and the staff had long since stopped checking the clock because time had ceased to mean anything useful. Anna Hayes moved through it all the way she always did, quietly, efficiently, invisibly. That was by design. She was the nurse people noticed only when they needed something. She handed instruments without being asked. She read vitals before the monitors alarmed. She anticipated pain and met it halfway with a calm that other nurses mistook for detachment and patients mistook for kindness. She was by every visible measure exactly what she appeared to be, a competent, experienced, unremarkable emergency room nurse who had been doing this job at Mercy General for 6 years. 6 years. Long enough that no one asked questions anymore. Long enough that her accent had softened and her hair color had changed twice, and her last name, the last name on her badge, on her license, on every official document she owned, was Hayes, not Cross. Long enough that she had almost started to believe she was actually Anna Hayes. Almost. Anna, a voice cut through the noise. Jenna, the charge nurse, 22 years in the EAR, immune to panic, allergic to drama, caught her arm near the supply cabinet. Bay 4 is going sideways, gunshot wound GSW to the upper thigh. They're saying femoral, but the paramedics can't get a read on how deep. Dr. Okafor's in surgery. Dr. Patel's got his hands in a chest cavity, and the residents... She exhaled sharply. The residents are residents. I'll go, Anna said. Simple. No hesitation. She was already moving. Bay 4 was controlled chaos, wearing a thin disguise. The man on the table was somewhere in his late 30s, thick-built, the kind of man who looked like he'd never been sick a day in his life, until tonight decided to correct that impression permanently. His name, according to the paramedic handing off the report, was Daniel Marsh. He'd been found 2 blocks from a gas station. The shooter or shooters were not in custody. Those details Anna filed away and immediately set aside. They were not her job. His pulse was her job. His blood pressure, 84/52 and dropping, was her job. The blood soaking through the temporary pressure dressing at a rate that suggested the word temporary was being very generous. That was absolutely her job. 2 residents flanked the gurney. Dr. Yoon, 2nd year, bright and earnest and visibly terrified. And Dr. Calloway, 3rd year, who was good in low-stakes situations and currently looked like a man standing at the edge of a roof. He's losing pressure fast, Calloway said to no one in particular. If it's femoral, we need a surgeon in here like now. We cannot manage a severed femoral artery at this level. Has anyone clamped the wound? Anna asked. Calloway blinked. We have pressure on it. That's not what I asked. Yoon looked up. The dressing is... Anna was already at the table, gloved, peeling back the dressing with the kind of controlled efficiency that came from somewhere the residents couldn't quite identify, but definitely noticed. She assessed what she saw in under 2 seconds. The wound, the angle, the blood flow, not a steady seep, but an arterial pulse, rhythmic and ruthless, a clock counting down in red. Her stomach dropped exactly 1 centimeter. Then it rose back up. She had no room for the drop right now. Get me a clamp, she said. Anna Calloway started. Now, Dr. Calloway, and someone get on the phone to the OR. Tell them we have a femoral laceration in Bay 4, and we need a surgical team in the next 4 minutes, or this man does not survive long enough to make it upstairs. Calloway grabbed the phone. Yoon moved to the supply tray with shaking hands. The man on the table, Daniel Marsh father, someone's son, someone's whole world in a body that was bleeding out on a Tuesday night, opened his eyes. They were brown, frightened, but present. "Hey," Anna said, leaning slightly into his line of sight. "I've got you. You hear me? I've got you." His lips moved. No sound came out. "Don't try to talk. Just look at me. Look right here." She touched the side of his face briefly, just enough. "Stay with me." His eyes held hers, and somewhere beneath the practiced calm of Anna Hayes, something older and sharper and surgical woke up. The clamp helped. It bought minutes. But minutes in a room like this are a currency that spends faster than it earns, and when the surgical resident, who finally arrived breathless, white coat half-buttoned, took one look at the situation and said, "I need to call Dr. Reed." Anna felt the clock tick louder. Dr. Marcus Reed, chief of surgery. The man whose name alone was enough to make residents straighten their posture. He was currently, per the OR board, finishing a routine valve repair on the 3rd floor. Routine. The word felt obscene given what was happening in Bay 4. "How long?" Anna asked. 15, maybe 20 minutes, the resident said. "He said he'd come directly." 15 minutes. She looked at the monitor. Pressure was at 79/48. Heart rate climbing 118, 122. The body fighting the way bodies fight, throwing everything it has at a wall that has already been breached. 15 minutes, she thought, is a very long way away. The monitor screamed. Not a warning tone, not the cautionary beep that says pay attention. The full alarm, the one that means the conversation is over and the body has stopped negotiating. Daniel Marsh's pressure crashed to 61/30. "He's crashing," Yoon's voice broke. "I see it." Anna's voice did not break. "Push the fluids wide open, both lines. But She stopped. She looked at the tray, at the clamp, at the angle of the wound and the way the blood was moving, and the 17 things her hands already knew about what needed to happen next, cataloged so fast it wasn't even thought it was memory. "Don't," said one part of her brain, the part that had built Anna Hayes from scratch, the part that had survived 6 years of reinvention. "You cannot do this. If you do this, everything ends. He dies in 4 minutes if you don't," said the other part. The older part, just couldn't. The part that had stood in operating rooms and read CT scans and stitched things that weren't supposed to be stitchable and saved lives that weren't supposed to be savable. 4 minutes. She looked at Daniel Marsh's face. He was still looking at her. "Stay with me," she whispered. And then, almost imperceptibly to herself, to the ghost of who she used to be, she added, "I'm coming back." Her hands moved. What happened next lasted 3 seconds. That was how long it took. 3 seconds timed by every person in that room who recounted the story later separately to different people, and all arrived at the same number with the same expression, a kind of stunned disbelief that doesn't have a clean name. The suture was in her hand. Her movements were not the movements of a nurse improvising under pressure. They were the movements of someone who had done this specific thing, this exact thing, hundreds of times. The needle angle, the tension on the thread, the closure technique, a modified figure 8, that is taught only in advanced cardiovascular surgical programs that requires years of practice to execute even in ideal conditions that should have been completely outside the scope of any registered nurse working in any emergency department anywhere in the country. It took 3 seconds. The bleeding stopped. The monitor, which had been screaming, began to settle. Not immediately, nothing in medicine is immediately, but within 45 seconds, the pressure began to climb back towards something that resembled a living person's numbers. 68, 74, 81. The room was silent. Yoon was staring at Anna's hands. Calloway had dropped his pen. The surgical resident had gone the particular shade of pale that only medical professionals achieve when they witness something that violates their working model of reality. Anna released a slow breath. She stepped back from the table. She stripped the gloves. Her face was composed, neutral, carrying the expression of someone who has done a difficult but necessary thing and has now set it aside. She had almost made it to the doorway. "Stop!" The voice came from behind her, low, quiet. The particular quiet of a man who does not need volume because volume has always come to him. Anna stopped. She turned. Dr. Marcus Reed stood in the entrance to Bay 4. He was still in his surgical cap, still wearing the faint impressions of his OR mask on either side of his face. He had clearly come directly as promised, and he had arrived in time to see the last 15 seconds of what she had done. His eyes were fixed on her with an expression she couldn't quite categorize, not anger, not admiration, but something more dangerous than either. Recognition. Dr. Reed, Calloway said, relief flooding his voice. The patient is... I can see the patient. Reed didn't look away from Anna. I'm asking about her. The room held its breath. Anna met his gaze, steady. She had spent 6 years perfecting steady. Anna Hayes, she said. Ian, night shift charge nurse. I was stabilizing the patient until surgical arrived. A beat of silence. That suture technique, Reed said, his voice almost conversational, is a modified Gamby closure adapted for vascular repair. It's taught in exactly 3 surgical programs in this country. I know because I helped develop the curriculum for one of them. He paused. I've seen it performed exactly 12 times in a clinical setting. 11 of those times I performed it myself. Another pause. Longer. The 12th was 6 years ago, in a different hospital, by a different person. Anna said nothing. My office, Reed said, now. She walked out of Bay 4 with her spine straight and her heartbeat doing something architectural and catastrophic behind her sternum. Jenna caught her in the hallway. Is everything okay? What does Reed want? Paperwork, Anna said. Protocol thing. Cover the bay. I'll be back. Jenna's eyes searched her face for 1 second longer than comfortable. Then she nodded and moved on because the ER doesn't pause for emotional subtext. Anna turned the corner, and as soon as she was out of sight, she pressed her back flat against the wall and closed her eyes for exactly 4 seconds. 4 seconds was all she allowed herself. Because in those 4 seconds, the entire architecture of 6 years collapsed inward like a building swallowing itself. Every careful choice, every document, every new habit, new name, new story. The apartment she decorated slowly, deliberately, like building a life, one small thing at a time. The colleagues she'd kept at arm's length, not from coldness, but from protection. The patients she'd loved, and she had loved them fiercely from behind the necessary glass of professional distance, because they were the reason she'd stayed in medicine, even when medicine had eaten her alive. All of it. 4 seconds. Then she opened her eyes, straightened her badge, Anna Hayes, RN, and walked toward Reed's office. Here's what you need to understand about Anna Hayes before she opens that door. She did not become a nurse because it was a step down. She became a nurse because it was the only way to stay near the thing she loved without being destroyed by what she had lost. She learned to find meaning in smaller doses, a held hand, a clarified discharge instruction, a patient who looked scared until she sat down next to them and talked. She told herself it was enough. On good nights, she almost believed it, and she was good at it. Not good the way people are good at things they've settled for. Good the way only people who were once exceptional at something larger can be good at something smaller, with a precision and a depth that other people sense without being able to name. 6 years is a long time to carry something. Long enough that the weight starts to feel like part of you. Long enough that you stop noticing it until someone presses exactly the right place and the pain arrives fresh as though it never aged at all. Her name was not always Anna Hayes. Her hands always knew that. Tonight, so did everyone else. Reed's office was everything its owner was not warm, carefully arranged, full of framed photographs and small acknowledgments from grateful patients. The kind of room that said, I am a person who has earned the right to care about how things look. Reed was standing at his desk when she entered. He did not sit. He did not offer her a seat. He said Emma Cross. The name hit her like cold water. She hadn't heard it spoken aloud in so long that for a fraction of a second she genuinely did not recognize it as hers. Then it landed all the way down. I don't know who you don't. Reed's voice was patient in the way of someone who has already decided where this conversation ends and is simply waiting for it to arrive. I knew your work before I knew your name. You published 2 papers on arterial repair techniques during your residency. I cited one of them in a surgical conference keynote in 2019. When I saw what you just did in that trauma bay, I didn't need to check records. I knew. He set a tablet on the desk, turned it toward her. A photograph, older, from a hospital newsletter, a younger face, same eyes, different name. Dr. Emma Cross, cardiovascular surgery. Fellow, rising star. The question isn't whether I know who you are. The question is what we do about it. Emma, because in this room, in this moment, she was Emma, whether she wanted to be or not, held his gaze. What do you want? She asked, quiet, direct, because she had not survived 6 years by flinching. Reed pulled out a chair and finally sat down, and in that motion she caught something she hadn't expected: exhaustion. Not the ordinary tiredness of a long shift, but the specific fatigue of someone fighting a battle that has been going on for longer than anyone outside this room knows. I want to make you an offer, he said. And before you refuse, because I can see you preparing to refuse, I want you to hear all of it first. She sat down. Not because she trusted him, but because the woman she used to be, the one with the steady hands and the surgical mind and the total inability to walk away from a problem, that woman was already leaning forward. My hands, Reed said. He placed them on the desk between them. And for the first time, Emma really looked at the hands of the chief of surgery at Mercy General Hospital, and she saw what everyone who worked with him had apparently been carefully collectively not seeing. The tremor was slight. If you weren't trained to notice fine motor disruption, you might read it as simply fatigue. But she was trained, and she noticed. Essential tremor, she said. Progressive, diagnosed 14 months ago. He withdrew his hands. I have compensated, I have adapted. The team believes I'm managing a minor neurological inconvenience. The board doesn't know, my malpractice carrier does not know. A pause. No one knows, except now you. Why are you telling me this? Because in 8 days, Reed said, I have a surgery scheduled that I cannot perform with these hands. And if I cancel it or hand it off, the questions start, and the answers to those questions end my career. He met her eyes. The patient is a 34-year-old father of 3 with a thoracic aortic aneurysm that will kill him within the month if we don't operate. The surgery requires someone with cardiovascular expertise that my current residents do not have. He paused again, deliberate. But you do. Emma stared at him. You want me, she said slowly, as though testing whether the words would hold weight, to perform a thoracic aortic repair as a nurse under your name inside a hospital where I have been hiding for 6 years. I want you to do what you were trained to do, Reed said. What you were born to do if the record before the scandal means anything, and I believe it does. He leaned forward slightly. And in exchange, what happened in Bay 4 tonight stays between us. Your identity stays between us. Anna Hayes continues to exist. The silence that followed was the loudest thing in the room. Emma looked at the desktop, at the photograph that was still facing her, at her own younger face, the face of a woman who had believed that talent was armor and excellence was protection, and that doing extraordinary things in extraordinary ways meant the world would meet her halfway. She had been wrong about that in the most devastating way imaginable. If anything goes wrong, she said, I lose everything, again. Yes, Reed said simply. He didn't dress it up. She respected that. And if it goes right, then a man lives who would otherwise die. And the best cardiovascular surgeon I have ever watched work even through a trauma bay window for 45 seconds is still operating. Emma stood up, walked to the window. The hospital spread below her in the night, lit and busy and alive, in the particular way that hospitals are alive urgently, always with too much at stake to slow down. I didn't kill that boy, she said. Her voice was low and precise and had been waiting, she realized, 6 years to say those words in a room where someone was actually listening. Reed said nothing. Senator Hale's son, the surgery they accused me of mishandling, the aneurysm that ruptured on the table. She turned. I did everything right, everything. The rupture was the result of a pre-existing weakness that wasn't visible on the imaging we had access to. I flagged it. I documented it. I told the attending that I had concerns. Her voice stayed level, just barely. The attending signed off. The surgery proceeded. The boy died. And when the senator needed someone to blame, I was the youngest face at the table. The most convenient. The one with no political protection and too much on record about my concerns to pretend I hadn't noticed something was wrong. Reed's expression did not change, but something behind his eyes did. So the investigation was structured to reach a conclusion that was already decided. She said it without bitterness, which was perhaps more disturbing than bitterness would have been. I could have fought it. My lawyer said I had a case, but fighting it would have taken 4 years and cost me everything I had and dragged every patient I had ever treated into the public record. She looked out the window again. So I disappeared instead. Silence. And built a new life, Reed said. And built a new life. A beat, which you are now holding over my head. He had the decency to look uncomfortable with that. I prefer to think of it as an offer, she finished. Yes, you said. She turned back to face him fully. And in this moment, the two of them, the surgeon with the failing hands and the woman with the hidden ones, faced each other across the length of his carefully arranged office. And whatever calculation was happening behind both pairs of eyes was too complex and too layered to be reduced to something as simple as leverage. Tell me about the patient, Emma said. Something in Reed's posture shifted. The tension didn't leave. She didn't think it was capable of leaving him entirely, but it reorganized itself into something that looked fractionally like relief. His name is Robert Ahern, Reed said, 34, construction manager, 2 daughters and a son under the age of 7. The aneurysm is at the descending thoracic aorta, 7 centimeters and growing. The imaging is consistent with Marfan's. Do you have the films? Reed reached into the desk drawer and produced a tablet. Passed it across. Emma took it, and for the first time in 6 years, she sat with surgical imaging and let herself look at it, not as a nurse performing outside her scope, not as a woman hiding what she knows, but as what she was. Her eyes moved across the scan the way they always had reading it, the way some people read music, not symbol by symbol, but as a whole, as a shape, as a story the body was telling about itself. The angle of approach, she said half to herself. Left posterolateral. She'll want a double lumen tube for the lung isolation. She being you, Reed said. Emma set the tablet down, looked at him. I haven't been in an OR in 6 years, she said. I know. My hands remember, my mind remembers, but memory and performance aren't the same thing. I know that too. And if I do this, if I agree to this, what guarantee do I have that you hold to your end? Reed reached into the same drawer and produced a sealed envelope. He placed it on the desk and pushed it toward her. That is a signed, dated, notarized statement of what I witnessed tonight. Who I believe you to be, what I know about the events 6 years ago. He met her eyes. It's in your favor. It's yours to keep. If I ever move against you, that document exists. A pause. You could, of course, also use it to expose me. That's by design. Emma looked at the envelope. Mutually assured destruction. Clean, direct. The only currency that neither of them could counterfeit. You've thought about this, she said. I've been thinking about it, he said. Since 14 months ago when my hands first shook during a closing stitch, and I looked up and saw my resident pretending not to notice. He exhaled. I've been looking for someone I could trust, and trust is not a thing that comes easily in a place like this. And then tonight, a nurse in Bay 4 sutured a femoral artery in 3 seconds, and the problem and the solution walked into the same room. Emma picked up the envelope, turned it over once, placed it in the pocket of her scrubs. I need access to the patient's complete file, she said. All imaging, all labs, the surgical plan as you've currently drafted it. I want to spend 3 days reviewing before I agree to 8 days from now. Done. I need 2 days in a simulation lab. There is a training center attached to University Medical. I have a connection there. I can arrange access without raising flags. Done. And if at any point between now and the ORR I assess that this surgery as planned puts the patient at unacceptable risk, we modify the plan. My call, no argument. Reed held her gaze for a long moment. Agreed. And the staff in Bay 4 tonight, Emma said. What do you plan to tell them? I've already been considering that, Reed said. Dr. Calloway and Dr. Yoon are residents. They're used to being unsure of what they witnessed. I'll speak with them not to instruct them to lie, but to contextualize. He paused. The truth is what they witnessed is ambiguous. A trained nurse performing an improvised stabilization maneuver. That's unusual, remarkable even, but not impossible to explain if no one looks too closely. And if someone does look closely, then we cross that bridge when we come to it. Emma nodded once, stood, smoothed her scrubs. I'm going back to my shift, she said. Oh, We don't speak about this in the department. You treat me the way you have always treated me, which is to say barely at all. Reed almost smiled. Understood. She was at the door. Dr. Cross, he said. She stopped. Her back was to him. She didn't correct the name. For what it's worth, Reed said quietly, I read your papers. All of them. You were extraordinary. A beat. You still are. That much was obvious in 3 seconds. Emma stood in the doorway for one moment that lasted longer than moments usually do. Then she walked back into the hallway, back into the noise, and the urgency, and the blood, and the beeping of a hospital that had no idea what it was harboring in its night shift, and she became Anna Hayes again. But something had shifted, something that 6 years of careful, deliberate, protective invisibility had kept pressed, flat, was beginning very slowly to remember that it had a shape. In the supply closet where she went to breathe for 2 minutes before returning to her patients, Emma Cross, Anna Hayes, pressed her back against metal shelving and held both of her hands out in front of her. Steady, surgeon's hands, someone had called them once, a professor, the first day of her fellowship. You have surgeon's hands, Cross, the kind that don't apologize for what they know. She had been 27 years old, and she had believed that being extraordinary at a difficult and meaningful thing was its own kind of protection. She had been so profoundly, so innocently wrong. But her hands were still steady. After everything, after the accusation and the investigation and the verdict that was never a verdict, but functioned as one after 6 years of learning to be small and invisible and safe, her hands were still exactly what they had always been. She lowered them, took a breath, and thought about a 34-year-old man named Robert Ahern with 3 children under 7 and an aneurysm that was counting down with all the patience of a thing that has never needed patience because it has always known it would win. Not this time, she thought, and she wasn't sure entirely whether she meant the aneurysm or something else. She walked back out onto the floor. Anna Hayes, night shift charge nurse, steady, efficient, invisible, but not perhaps for very much longer. The rest of the shift passed the way shifts do when your entire life has just detonated quietly inside a single conversation, loud on the surface, terrifyingly calm underneath. Anna moved. She charted. She administered medication with precise timing. She held the hand of a 71-year-old woman named Miriam who was afraid of needles and talked her through a blood draw by asking about her grandchildren. And Miriam told her about a boy named Oscar who played baseball and a girl named Lily who refused to eat anything that wasn't beige. Anna laughed in the right places. She was present. She was Anna Hayes fully and professionally and without visible seams. But the envelope in her pocket had a weight to it that was completely disproportionate to paper. She could feel it every time she moved. A constant, low-frequency awareness, like carrying a live wire coiled against your ribs. Reed's signed statement, her own past notarized. A record of who she was before she decided that survival required becoming someone else entirely. She hadn't looked at it again. She didn't need to. She had memorized the shape of the decision it represented before she'd even left his office, because that was how her mind worked and had always processed threat and possibility simultaneously the way a surgeon reads an imaging scan, not sequentially but all at once, the whole picture, every implication arriving at the same moment in a kind of organized flood. 8 days, Robert Ahern, a descending thoracic aortic aneurysm 7 centimeters expanding, 3 children, a wife whose name she didn't know yet but would, a surgery that had to happen in a pair of hands, the official, credentialed chief of surgery hands that couldn't reliably hold a needle through a 3-hour procedure without betraying the man behind them. And then her hands, which could, which had. In 3 seconds in front of witnesses in a trauma bay that would now carry a story people would tell for years. At 4:47 in the morning in the break room, she poured herself a cup of coffee she didn't want and sat down across from Jenna, who was eating a granola bar with the focused intensity of a person who has been awake too long to pretend food has texture. You okay? Jenna asked. Not aggressively, not accusatorially, just Jenna, 22 years of reading people built into a 2-word question. Long night, Anna said. Reed pull you in for something. Protocol documentation. The femoral repair in Bay 4. He wanted to review how we handled the gap between patient arrival and surgical availability. A lie so smooth it was almost boring. 6 years of practice, Jenna chewed. Calloway came to find me after. He was weird. Anna wrapped her fingers around the cup. Weird how quiet weird. Calloway's never quiet. He asked me how long you've been working here. Jenna looked at her steadily. I told him 6 years. He nodded like that answered something. A pause. Did it? The break room was very still. Probably just processing a rough case, Anna said. Resident's first near-loss femoral. It shakes you. Jenna held her gaze for exactly 1 beat too long. Then she stood crumpled the granola bar wrapper and said, Get some sleep when you get home. You look like you're holding something heavy. She left. Anna sat alone with her coffee and the fact that Jenna, who had never been wrong about a person in 22 years, was not wrong now. The envelope sat against her ribs like a second heartbeat. She drank the coffee. She went back to work. When the shift ended at 7, she changed in silence, said brief goodbyes to the outgoing team, and walked out into a morning that was doing the particular thing mornings do when your internal world doesn't match the external one. It was luminous and unreasonably cheerful, full of bird noise and the smell of someone nearby making breakfast. And none of it had the decency to acknowledge that her life had just pivoted on a 3-second suture. She drove home, sat in her car in her parking spot for 11 minutes without getting out. Then she went inside, sat at her kitchen table and opened the envelope. Reed's statement was 2 pages, precise legal in structure, careful in language. It documented what he had witnessed, what he believed about the events 6 years prior, and his professional assessment of her conduct then and tonight. It used her real name, Emma Cross, MD. It did not flinch from the scandal. It did not try to rewrite history. It simply stated clearly and on record that the history as publicly recorded was incomplete, and that in his professional opinion, the surgeon at the center of it had been failed by the system meant to protect both her and her patients. She read it twice. Then she folded it, put it back in the envelope, and held it in both hands for a long time. Nobody had ever written that down before. Not officially, not with a signature attached. She had told the truth 6 years ago to the people who were supposed to hear it, and they had listened with the expressions of people performing listening while their minds were already elsewhere. She had said, I flagged the imaging anomaly. I documented my concerns. The attending signed off. And they had nodded and written things down, and at the end of the process, the report said, inadequate preoperative risk assessment by the surgical fellow. Her name, her record, her career folded up and handed back to her in pieces. And now a man she barely knew had written the other version down, the true version, and signed it. She put the envelope in the drawer where she kept things that mattered. Her nursing license, Anna Hayes, renewed every 2 years like a ritual of reinvention. A photograph of her mother who had died 4 years ago without knowing where her daughter had gone. A birthday card from a patient she'd cared for the year before, a 68-year-old retired teacher named Gerald, who had written in shaky but deliberate cursive, You have a gift, Anna. Don't waste it. She had read that card many times. She had never quite known what to do with it. She closed the drawer, and then because the part of her that had survived by being relentlessly practical would not allow her to simply feel things without simultaneously doing something useful. She opened her laptop and pulled up every published case study she could access on descending thoracic aortic repair. She hadn't read surgical literature in 6 years. She had avoided it the way you avoid the street where something terrible happened, not from weakness, but from self-preservation. Tonight she read. She read until noon. Then she slept for 4 hours, woke up, and read more. By evening, Emma Cross was back. Not loudly, not visibly, but behind Anna Hayes' eyes in the part of her mind that had never actually gone dormant, the surgeon was reviewing, reassessing, rebuilding the scaffold of knowledge and judgment that 6 years of deliberate neglect had left intact in ways she hadn't entirely expected. Memory, she was discovering, is not as cooperative as she'd hoped. It was coming back in floods, not in orderly increments. The anatomy of the aorta. The specific considerations for thoracic approach, all of it arriving with the force of something that had been held under pressure and was now cautiously being allowed back to the surface. She called the simulation center at 7 in the evening. Her contact there was a woman named Dr. Patricia Ose, a surgical educator. Emma had trained with briefly during her fellowship before everything fell apart. They had not spoken in 6 years. Emma had not allowed herself to maintain those connections because connections were threads and threads could be followed. Her hands trembled slightly as she dialed, not from neurological impairment, from fear. Osei picked up on the third ring. Yes, Patricia. A breath. It's Emma Cross. The silence on the other end lasted long enough that Emma counted it. 4 seconds. 5. Osei's voice was careful, measured. The voice of someone navigating a sudden minefield with great deliberateness. I wasn't sure I'd ever hear from you again. I know. I'm sorry for that. She had rehearsed this. The rehearsed version was cleaner. She set it aside. I need 2 days in a simulation lab. I need to work with the aortic models. I need to do this quietly and I need to do it soon. Another pause. Shorter. Are you going back into surgery? I don't know yet, but I need to know if I still can. Honest. Dangerously honest, but Osei had always responded better to truth than to performance. And you're the only person I trust enough to ask. The pause this time was the kind that meant a decision was being made. Wednesday and Thursday, Osei said. 6 in the morning. Side entrance. You'll be the only one there at that hour. A beat. Don't tell me anything else yet. Let me see what your hands remember before we have any other conversation. Thank you, Emma said. Don't thank me yet. A pause. Emma, I'm glad you called. She hung up, sat with that for a moment. I'm glad you called. 6 years of deliberate isolation and someone was glad she'd called. It shouldn't have hit as hard as it did. It hit harder than almost anything had in 6 years. She made tea she didn't drink and went to bed. She dreamed of the OR, not as a nightmare, as a homecoming, which was almost worse. She woke up at 3 in the morning with her heart pounding and her hands completely steady in the certain terrifying knowledge that she was going to say yes. She hadn't admitted that to herself yet, but her body already knew. The next day, she went back to Mercy General for her shift, and everything was different in ways that were invisible to everyone but her. The floor moved the same way. The monitors beeped the same cadences. Jenna was on brisk and efficient, offering coffee and running interference on a family in the waiting room who had opinions about the triage timeline. The residents rotated through tired and caffeinated, the usual mix of confidence and terror that defines the 3rd and 4th years before they calcify into something more durable. Calloway found her near the medication station at 10 a.m. He was trying to be casual and managing it the way residents manage things they're not trained for, with obvious effort and incomplete success. Hayes, he said. Not her first name, she noticed. Calloway. She didn't look up from the chart. I wanted to say the other night with Marsh, that was impressive, what you did. He paused. Really impressive. Patient presented a need. I stabilized. That's the job. She clicked through the chart. Steady. Anna Hayes fully deployed. Right. He shifted his weight. It's just the technique. I was looking it up. That kind of vascular closure, Calloway. She looked up now, met his eyes. Hers were patient and warm and absolutely immovable. Daniel Marsh is alive. His pressure stabilized, he went to surgery, and Dr. Reed repaired the artery with full visibility because the bleeding had been controlled. That's the outcome. That's what matters. A pause. Whatever questions you're building up, to ask yourself whether those questions help Mr. Marsh in any way. If the answer is no, let them go. Calloway looked at her for a long moment. He was not unintelligent. She could see him understanding that this was not an invitation to push further. She could also see something more complicated, the particular dissonance of a young physician who has been trained to pursue anomalies and is now being asked very clearly by someone he respects to let one go. Right, he said again, and then quietly, I hope you know whatever that was, I'm glad you were there. He walked away. She exhaled slowly through her nose and went back to the chart. That afternoon, a message appeared in her hospital inbox. Internal encrypted from Reed. It contained Robert Ahern's complete file. No subject line, no text, just the file and one line at the bottom, when you're ready. She opened the file in the break room on her phone, shielded by a coffee cup, in the practiced art of looking like someone reading something completely unremarkable. Robert Ahern, 34. The imaging was even cleaner than what Reed had shown her the night before. Full CT, angiography, 3-dimensional reconstruction, the aneurysm laid out in precise digital relief. She had been right about the approach. left posterolateral. The repair would require a period of aortic cross-clamping, which meant a narrow window. Every minute of clamping was a minute of risk to the spinal cord. Speed mattered. Precision mattered. The ability to work under the compounded pressure of urgency and exactness simultaneously without letting either compromise the other. That ability had always been hers. She was not certain 6 years later that it still was. That was what Wednesday was for. She was reading the aneurysm measurements for the third time, committing them to the part of her mind that stored surgical specifics with the fidelity of a recording when Yoon appeared in the break room doorway. "Anna, do you have a second?" She locked her phone. "Sure." Yoon came in and sat down across from her, which was unusual. Yoon was a hoverer, not a sitter. The sitting meant something. "I know you said the other night was just stabilization." Yoon began carefully, the way second years are careful. They've learned enough to know the weight of words, but not yet enough to always choose them right. "And I respect that. I'm not trying to make something out of nothing." "But," Anna said. Yoon looked at her hands, then back up. "I did my undergrad at Duke. My roommate was pre-med, went into cardiovascular. We used to study together, so I've seen a lot of technique videos, a lot of procedure walkthroughs." She paused. "What you did was not improvisation." "I don't know what it was, but it wasn't improvisation, and I—" She stopped. Started again. "I just wanted to say that whatever it was, however, you know what, I think you should know that it was the most controlled thing I've ever seen in an emergency situation. And I've seen Dr. Reed operate." A beat. "I won't say anything. I just wanted to say that." Silence. Anna looked at this 27-year-old woman who was trying in her careful second-year way to extend something that looked remarkably like solidarity across a gap she didn't fully understand. "Thank you, Yoon," she said. "You're the reason I want to do emergency medicine." Yoon said, standing. "Not just the other night. Generally. You've always been—" She stopped, looked briefly embarrassed by her own sincerity. "Sorry, that was weird." "It wasn't," Anna said. Yoon left. And Anna sat alone into the break room with the weight of being witnessed, not exposed, not accused, but seen by two people in 2 days who were looking at her and recognizing, without knowing exactly what they were recognizing, that what they were seeing was more than Anna Hayes had ever claimed to be. She thought about Yoon's face, the earnestness in it, the faith. She thought about Yoon 10 years from now, in her own OR, making the kind of decision that cannot be made by protocol alone. She thought about what it would mean for a young physician like that to discover later that the nurse she'd admired had been a surgeon who'd given up. She thought about Robert Ahern's children, 3 of them, under 7. She closed her eyes. It wasn't really a decision anymore. Maybe it hadn't been since the moment she opened the patient file. Maybe it hadn't been since she stood in Reed's office and said, "Tell me about the patient," before she'd even consciously agreed to listen. Wednesday morning, 6 a.m., side entrance. Her hands would remember or they wouldn't. She was terrified to find out. She was more terrified not to. And underneath the terror, quiet and stubborn and deeply inconvenient, something else, the feeling of a woman who has been running so long, she forgot she knew how to stand still and is just now slowly turning around. She put her phone in her pocket, finished what was left of the coffee, went back to the floor. Anna Hayes walked into the hallway, but the woman inside her was already somewhere else, standing at a simulation lab bench at 6 in the morning with surgeon's hands and 6 years of buried truth, about to find out exactly what she was still made of. And she was not, for the first time in a very long time, looking away. Wednesday arrived the way important days always do, quietly, without announcement, indistinguishable from any other morning, until you're already inside it and the door is closed behind you. Emma was at the simulation center side entrance at 5:52 a.m., 8 minutes early. She had not slept well, but she had slept, which she counted as a victory. She had eaten toast coffee, the functional minimum, because she knew better than to walk into any high-performance situation with her blood sugar doing something unhelpful. These were surgeons' habits, dust-covered but intact, resurfacing automatically the way deeply trained behaviors do when the context demands them. Osei was already inside. She was standing at the central workbench with her arms crossed and an expression that was doing several things at once: warmth, caution, professional assessment, and something that looked like the careful management of emotion by someone who has had a great deal of practice at it. She had aged the way good people age, in ways that looked earned rather than imposed. Her hair was shorter. There were new lines at the corners of her eyes. She looked like someone who had spent 6 years doing meaningful work and sleeping adequately, which Emma found both comforting and quietly devastating. "You look like you haven't slept in a week," OC said. "I slept last night," Emma said. "The week before is a different conversation. Take your coat off. Come here." No preamble, no extended reunion. This was why she had called Osei, because Osei was the specific kind of person who understood that sometimes the kindest thing you can offer someone is to skip directly to what matters. Emma took her coat off, walked to the bench. The simulation model was already set up. Synthetic aorta, anatomically accurate, the relevant section descending thoracic positioned and ready. The instruments laid out to the left with the particular neatness of someone who learned early that surgical preparation is half the surgery. Emma looked at it. Her hands at her sides were very still. "Whenever you're ready," Osei said, not rushing, not performing patience either, actual patient, the way people are patient, when they understand that the person in front of them is standing at the edge of something significant and needs a moment to choose to jump. Emma picked up the needle driver. The weight of it, the specific familiar weight of a surgical instrument in a surgeon's hand, hit her somewhere behind the sternum. Not pain, something more complicated than pain. Recognition. Her hand closed around it the way hands close around things they have never forgotten. She began. For the first 90 seconds it was rough. Not dangerously rough, not the hands-shaking technique failing roughness she had privately feared, but the roughness of returning, of re-entry. The way a musician who has not played in years sounds in the first few minutes of practice. The structure is there, the knowledge is there, but the fluency is catching up. Stumbling slightly on the gap between what the mind knows and what the body has been asked to do lately. She worked through it, didn't stop, didn't apologize to Osei for the imprecision, just worked the way she had always worked, with the stubborn, focused intention of someone who has decided that the only direction is forward. By minute 4, something loosened. By minute 7, it was gone, the roughness, the lag, the 6-year gap between knowing and doing. Her hands found the thread they had been following since she was 24 years old in a surgical skills lab, being told by a professor that she had the instincts of someone twice her age. They found it, and they held it, and they did not let go. Osei watched without speaking for 11 minutes. Then she said quietly, "There you are." Emma didn't stop working. "Was there any doubt?" "Yes," Osei said plainly. "There was real doubt. 6 years is a long time to ask hands to remember." A pause. "But I'm looking at them. Remember, showing by." Emma completed the synthetic repair, set the needle driver down, looked at the result. Clean, precise. The kind of closure that didn't just function, but was in the specific aesthetic of surgical craft. Correct, the word surgeons use when something is not merely adequate, but is exactly what it should be. Nothing more and nothing less. "Talk to me about the case," Osei said. Emma talked. She laid out a Hearns file from memory, the measurements, the approach, the cross-clamp considerations, the spinal cord risk, window, the contingencies. She talked the way she had once talked in case presentations, with the fluency of someone for whom this language was native and not acquired. She heard herself and recognized herself, and it was one of the stranger experiences of the last 6 years, stranger even than opening Reed's envelope, stranger even than hearing her own name spoken out loud in a room she hadn't expected. When she finished, Osei was quiet for a moment. "The plan is sound," she said. "The approach is right. The timing window is tight. You'll want to target under 18 minutes of cross-clamp time if possible." She looked at Emma directly. "Can you do it under 18, Fun? In an ideal environment, yes. With full team support, yes." A beat. "The team won't know who they're following." Osei's expression shifted. Meaning the arrangement I'm operating under is complicated." "How complicated?" "I'll be in the OR as a scrub nurse. The surgery will be attributed to the chief of surgery. I'll be performing it, but officially I won't exist in that room." In the silence that followed was a specific kind of silence, the kind that contains a person actively deciding whether to ask the next question or whether the next question will take them somewhere they are not prepared to go. "Emma," Osei said, That is not a complication. That is a catastrophe waiting for the right moment. I know. If anything goes wrong. I know. If the patient has a complication, if there's an inquiry, if anyone in that OR looks too closely at the footage or the notes or the instrument handling, Patricia, Emma looked at her. I know. I have run every version of this. I understand exactly what the exposure is. A pause. I also understand that without this surgery, Robert Ahern dies in under a month. His aneurysm is at 7 centimeters, and the growth rate on the sequential imaging is not subtle. Her voice was quiet, completely steady. I am not doing this because I'm out of options. I'm doing it because he is. O.C. pressed her lips together, looked at the simulation bench, looked back. You need 2 days in here, she said finally. Not one thing. 2. You said, soy. I said Wednesday and Thursday. I'm saying use both. She moved to reset the model. We're going to work the cross-clamp scenario 6 times this morning. Then we're going to do complication management hemorrhage dissection, the scenarios you pray you never see and need to be ready for. And tomorrow we're going to run it clean, full sequence timed. She looked up. If your hands hold through 2 days, you're ready. If they don't, we have a different conversation. Emma nodded once. Okay. And I want you to eat something real, not whatever you had this morning. Ose produced a protein bar from her coat pocket and set it on the bench beside the instruments with the particular efficiency of a person who anticipated this and came prepared. You're not a resident anymore. You can't run on adrenaline and stubbornness. Emma almost smiled. I've been doing exactly that for 6 years. I know, look at you. Ose's voice had something in it that wasn't quite grief and wasn't quite anger, but was somewhere in the territory between the feeling of watching someone you admire diminish themselves for reasons that are real and valid and still somehow deeply wrong. You were the best I ever trained with, and you've been changing bedpans. I've been saving lives, Emma said, and there was something in her voice that surprised even herself, not defensiveness, but conviction. Real earned conviction. Different scale, same purpose. Ose looked at her for a moment. Then she said quietly, yes, right. Yes, you have. And she meant it. They worked for 4 hours straight. By the time Emma left the simulation center on Wednesday afternoon, her shoulders ached in the specific way that OR work produces the sustained, focused muscular effort of fine motor precision under psychological load. It was a feeling she had not had in 6 years. It felt disconcertingly like coming home to a house she'd been told had burned down and finding it standing. She drove back toward her apartment with the windows down because she needed the air and the noise and the ordinary grounding reality of traffic and other people's music bleeding out of passing cars. She needed something external and uncomplicated to balance the internal, which was neither. Her phone rang. Reed. She answered on the second ring. I'm on my way home. How did it go? He was carefully not asking the real question, which was, are you still capable, or did I misjudge this badly? It went, she said. I'll know more after tomorrow. The surgery is in 6 days. I know when the surgery is. A pause. The patient's wife called this morning. She wanted to know the surgeon's name, the credentials. I gave her mine. Another pause. She asked if there was anyone else in the room she should know about. I told her the team was experienced and she was in excellent hands. Emma felt something move through her that was unpleasant. She deserves the truth. She deserves her husband to survive, Reed said. Not unkindly, with the weight of someone who has made a calculation he is not proud of and has made it anyway because the alternative is worse. One thing at a time. She didn't answer that because she wasn't sure he was wrong and she wanted to be. I'll be in touch after tomorrow, she said, and ended the call. That night, for the first time in 6 years, Emma Cross sat at her kitchen table with a surgical atlas open in front of her and let herself be fully unreservedly who she was. Not Anna Hayes carefully managing the edges of what she permitted herself to know. Not a woman navigating the performance of a smaller life. Just Emma. Reading the anatomy she loved, thinking the thoughts she was trained to think, feeling the particular deep satisfaction of a mind fully engaged with the work it was built for. It lasted 2 hours before the fear came back. But those 2 hours were the most purely herself she had been since she was 28 years old. and didn't yet know that the world was about to demonstrate exactly how little talent protects you from the things that people with power choose to do. She closed the atlas, went to bed. This time she slept without dreaming. Thursday at the simulation center, Osei ran her through the complications: intraoperative hemorrhage, dissection extending beyond the operative field, spinal cord ischemia, warning signs, and the protocol adjustments required in real time. Each scenario arrived without warning. Osei would change the model mid-procedure, introduce the problem, and watch how Emma responded. She responded, not perfectly. The hemorrhage scenario in the second run produced a 30-second hesitation, not from panic, but from the recalibration of a mind adjusting from textbook memory to active problem solving, and 30 seconds in a real OR is 30 seconds. Osei called it out. Emma corrected. They ran it again. By the fifth scenario, there was no hesitation. By the end of the second day, Osei stood across the bench with her arms crossed and her expression doing the thing it does when a teacher is watching a student exceed what the teacher dared to hope for and is managing the particular complicated pride of that. Time the final run, Osei said. Cross clamp to release 16 minutes 40 seconds. Under 18. Comfortably. Emma set down the instruments. Her hands were steady. Her whole body was tired in the particular way that good hard work makes the body tired, not depleted, but spent the way a runner feels at the end of a race they trained for. Complete. I need to ask you something, Osei said. Ask. After this surgery, what happens to Emma Cross? The question landed and sat there between them, and Emma did not answer immediately because the honest answer required a level of certainty she had not yet assembled. I don't know, she said finally. Is Anna Hayes still an option? After the OR? I don't know that either. Do you want her to be? Osei's voice was careful, not mushing. Genuinely asking. Emma looked at her hands, the hands that had spent 6 years doing work that mattered and that would spend 6 days from now doing the work they were built for. Both truths, both real. I want Robert Ahern to go home to his children, she said. After that, I'll figure out what I want. Osei was quiet for a moment. Then, I kept your papers, you know, both of them. I've assigned them to residents. Your name's on them. She paused. No one knew you were still in the building, so to speak. But your work was still teaching people. I thought you should know that. Emma didn't trust herself to speak for a moment. Thank you, she said. Don't thank me. Just when this is over. Whatever comes next, don't disappear again. Osei picked up her coat. The world doesn't have so many surgeons like you that it can afford to lose them twice. She walked out. Emma stood alone in the simulation lab with the particular silence of a space that has held something important and is now simply holding its breath. She was ready. That was the terrifying, clarifying, inescapable conclusion at the end of 2 days, and every fear and every doubt and every version of the worst-case scenario she had run obsessively through her mind since Rita had said to Emma Cross and the world had pivoted. She was ready. Her hands were ready. The surgeon was ready. What she was not ready for arrived the following morning before she'd even left her apartment for her scheduled shift. A knock at her door at 6:15 a.m. She opened it without thinking she was running on post-simulation exhaustion and the habituated assumption that people who knock at 6 a.m. are neighbors with package deliveries or noise complaints. The woman standing on the other side of her door was approximately 30 years old. Dark hair, expensive coat, the particular controlled composure of someone who has rehearsed this moment many times and is now discovering that the rehearsal was insufficient preparation for the real thing. Emma did not recognize her face, but she recognized something in her eyes, a shape of grief that Emma had seen before in photographs and news covers, saw on the face of a woman standing at a press conference microphone 6 years ago, saying her brother was gone and someone had to answer for it. The woman said, "My name is Victoria Blackwood. Senator Hale is my father." She paused. "You're Emma Cross. I've been looking for you for 8 months." Another pause. The composed delivery cracking just at the edges. "My father is dying and you're the only person who can save him." The door was open. The morning was behind her. 6 years of careful, deliberate survival were behind Emma, and in front of her stood the daughter of the man who had destroyed her life, asking her to save it. Emma Cross looked at Victoria Blackwood for a long time, and then she said, "You'd better come in." Victoria Blackwood stepped inside like a woman who had rehearsed confidence and was now running on the fumes of it. Emma closed the door, didn't offer coffee, didn't gesture to a seat, just turned and looked at her, really looked the way she had learned to look at patients reading the body for what the mouth wasn't saying yet. Victoria was holding herself together with the particular rigid posture of someone who has cried recently and is determined not to do it again in front of a stranger. Her eyes were clear but tired. The expensive coat was slightly wrinkled. She had not slept well either. Good said the part of Emma that was still angry and then immediately no, not good. Stop. How did you find me? Emma asked. It took 8 months, Victoria said. I hired someone. A researcher, not a private investigator. I want you to understand that. Someone who works with documentary journalists. I gave her everything I had, your physical description, your background, your specialty, the assumption that you'd stayed in medicine because people like you don't leave medicine even when medicine burns them. She paused. She narrowed it to 4 cities. Mercy General was the third one she checked. The researcher, does she know who I am? She knows I found who I was looking for. She doesn't know your current name or where you work. Victoria held her gaze. I came alone. I told no one, including your father. Something moved across Victoria's face. My father doesn't know I'm here. My father. She stopped, started again with visible effort. My father had a stroke 14 weeks ago. He's in a rehabilitation facility. His cognition is largely intact, which is both a mercy and a particular kind of punishment, given what he knows he did. She met Emma's eyes. He knows what he did. The room held that sentence for a moment. Emma walked to the kitchen table and sat down. Not as invitation as necessity, because her legs had decided that standing was no longer their preferred mode of operation. She pressed both hands flat on the table. Steadying. Talk, she said. Victoria sat down across from her, and she talked. Senator Hale Edmund Hale, 3 terms Judiciary Committee, a man whose name had been attached to hospital funding bills and medical malpractice reform, in the same years he had used his position to redirect a malpractice investigation toward a convenient target, had been declining for 2 years before the stroke. The stroke had accelerated everything. He was now 71, partially paralyzed on his left side and in possession of a cardiac condition that his current care team described in the language of careful medical professionals managing a powerful family's expectations as complex and progressing. What that meant, stripped of its careful language, was that Edmund Hale had a cardiac valve situation, a degenerating bicuspid aortic valve with concurrent aortic root involvement that required surgical intervention or would kill him within months. The surgery was high risk. His age, his post-stroke status, his overall cardiovascular load made it high risk. 2 surgical teams had reviewed his case. Both had agreed on the procedure. Neither had inspired Victoria's confidence. The first team, she said, is technically competent. The lead surgeon has good numbers, good outcomes. But when I sat in the consultation, he talked about my father the way people talk about a car that needs an expensive repair, like the goal was to hit the metrics and move on. She paused. The second team is better, more thoughtful, but the lead surgeon told me plainly that given the complexity of the root involvement, this case was at the edge of his confidence scope. And you think I am the right person because, Emma began, because I read your papers, Victoria said, both of them, the one on modified repair techniques for bicuspid valve pathology and the one on outcomes in high complexity aortic root procedures. A pause. I read them before I started looking for you. I read them because my father's cardiologist mentioned them as foundational work in a subspecialty that doesn't have enough voices yet. He didn't know who he was describing to me. Her voice tightened. I didn't know either. And then I looked up the author, and I understood why the author had disappeared. Silence. Victoria, Emma kept her voice level. It cost something. Your brother died on my table. My brother died on your table because my father pressured an attending physician to approve a surgery that you had flagged as high risk, Victoria said, and she said it with the clean, flat precision of a person who has lived with this truth long enough that speaking it no longer destroys her, though the marks of the destruction are still visible if you know where to look. I know that. I have known it for 4 years. It took me 2 years after his death to stop being angry enough at everyone to start asking the right questions. And the right questions led me to the documentation you filed, the attending sign-off, the sequence of events. Her jaw tightened. My brother was 23 years old and my father loved him so much it made him reckless. He couldn't accept the risk. He pushed for the surgery because waiting felt like giving up. And when it went wrong, he needed somewhere to put the unbearable thing he had done. So he put it on you. Emma looked at the table. You should have let him carry it, she said quietly. Not accusing, just honest. Yes, Victoria said. He should have. He didn't. And I can't undo that. A pause. What I can do is ask you woman to woman, not as Senator Hale's daughter, but as someone who has spent 4 years trying to make something right that my family made very wrong. What I can do is ask you to not let my father's mistakes become the reason another man dies. Emma looked up. He's not a good man, Victoria. No, Victoria said simply. He's not. He's also my father. And he's also a patient. And I think you know better than almost anyone what it costs to reduce a person down to the worst thing they have done and then make medical decisions based on that reduction. The words arrived with the precision of something aimed very carefully. Emma felt them land, because Victoria was right. In the most infuriating, most clarifying, most completely true way, she was exactly right. First, do no harm. The oath doesn't say first do no harm, unless the patient is responsible for your suffering, in which case apply judgment. It doesn't say unless, it just says first. Tell me about the current cardiac team's proposed approach, Emma said. Her voice had changed slightly. Victoria heard it. Her posture shifted fractionally, but Emma caught it. Victoria produced a folder from her bag, passed it across. Emma opened it, Skibram. Her eyes moved quickly, processing, and the part of her that had spent 2 days in a simulation lab and 3 nights with surgical atlases was already 3 steps ahead of where she was on the page, already building the picture, already seeing what the teams had seen and what they might have missed. The root involvement is more extensive than they have accounted for in the primary plan, Emma said. This approach handles the valve, but if they encounter the degree of root pathology that these measurements suggest, they'll be improvising in the middle of the procedure. She turned a page. In post-stroke, with the anticoagulation requirements, the clotting management has to be... She stopped herself. She was consulting. She was already consulting and she hadn't decided anything yet. She closed the folder. I need you to understand something, Emma said. I am not currently operating under my own credentials. My license was suspended and I have not petitioned for reinstatement. If I involve myself in your father's care in any official capacity, I expose myself legally, professionally, and personally. Everything I have rebuilt, even the small, limited thing I have built, it is at risk. I know, Victoria said, and I have a surgery in 5 days, a patient who needs me, a commitment that was made before you knocked on my door. Emma looked at her steadily. Your father cannot be my priority right now. Victoria nodded slowly. I'm not asking for right now. I'm asking for after. Whatever shape that takes, a consultation, a review of the plan with the current team, an anonymous second opinion if that's what's possible. She paused. Anything that gives him a better chance than he currently has. And if I say no, Victoria looked at her, and what was in her eyes in that moment was not threat, not manipulation, just the naked, unprotected reality of a woman who has run out of other options and knows it. Then I respect that, Victoria said, and I live with it, and so does he. Her voice dropped. And so do you, I suspect, because you're the kind of doctor who lives with these things. That's obvious from everything you've done, even in the life you've been living. She glanced around the apartment briefly. You haven't stopped being a doctor, Emma. You've just been being one in a smaller room. The phrase landed with the force of an echo. It was almost exactly what she had said to Osei. Different scale, same purpose. Victoria Blackwood had arrived at the same truth from the opposite direction. Emma stood up, went to the window, stood with her back to the room for a moment. 5 days. Ahern's surgery 5 days away, her hands ready. Reed's agreement holding. Anna Hayes' carefully constructed existence currently balanced on a surface that had been vibrating with increasing urgency since a trauma bay door crashed open and a bleeding man changed everything. And now this. the senator who had taken her career, his daughter who had spent 4 years trying to make it right, a patient who was arguably her enemy, and also by every principle she had chosen to build her life around, simply a patient. She turned back. "I want the complete file," she said. "Imaging, cardiac catheter results, everything the two teams provided in their consultations. I want to review it independently. I make no promises about what happens after that review." She looked at Victoria directly. "And I need you to understand, if I determine that the current surgical plan is adequate, I will tell you that, and I will not involve myself further. I am not doing this because I owe your father anything. I am doing it because the oath I took doesn't come with exceptions." Victoria released a breath that she'd clearly been holding for longer than this conversation. "Thank you," she said. "Don't thank me yet," Emma said, and she heard Osei's voice in her own words and felt the particular irony of that fully. Victoria left 20 minutes later, the folder on Emma's table and a secure email address exchanged for the full file. Emma stood at her window and watched the street below and did the accounting she had been doing since Wednesday, a running compulsive ledger of exposure and risk and obligation and consequence that kept producing results she didn't like and couldn't argue with. She was late for her shift. She texted Jenna a traffic excuse that was technically true since she had to drive to the hospital and traffic existed. She was not a person who lied frequently. She was a person who had learned under duress to be precise about what constituted a lie. The shift was ordinary in all the ways that felt increasingly surreal given the context she was carrying. A pediatric asthma case. A man in his 60s with chest pain that resolved into anxiety before it could resolve into anything worse. 3 medication consults. A long conversation with an elderly woman named Beatrice, who had come in for dizziness and stayed for the company, and who told Emma about her late husband with such love and such specificity, his habit of whistling off-key, his inability to throw away old newspapers, that Emma found herself laughing in a way that felt almost unfamiliar. Real. Unguarded. Beatrice grabbed her hand before she left. "You're a good one," she said. "I can tell the good ones." "Take care of yourself, Beatrice," Emma said. "You too, sweetheart. You look like you've got a lot on your shoulders." Emma smiled. "I'm managing." "That's not the same as okay," Beatrice said, and she patted Emma's hand and let it go, and Emma stood there for a moment after she left with the particular feeling of having been seen gently by someone with nothing to gain from the seeing. She went back to work. At 2 in the afternoon, Reed appeared in the corridor, casual, unremarkable, the chief of surgery doing his visible presence rounds. He stopped at the nursing station where Emma was charting, said something brief about a policy update, laid a single sheet of paper on the counter, the updated OR schedule standard document, and moved on. She looked at it when he was gone. Ahern's surgery Friday 7 a.m. Her name was not on it, Reed's was. The team was listed his first assist, a scrub tech, an anesthesiologist named Dr. Yuri Petrov, who was by reputation unflappable and discreet. At the bottom in Reed's handwriting, barely visible, Petrov knows. Told him what he needs to know. He's in. Emma folded the paper, put it in her pocket, processed the information. One more person, an anesthesiologist, who knew or knew enough, who had agreed, which meant he had his own calculation about what this was worth. She thought about Petrov's calculation. A good anesthesiologist knows things. About what's happening in the OR, about who's performing, about the quality of the hands working above his gases. He would know that within the first 2 minutes of Friday's surgery exactly whose hands were working. He would have made his peace with that before agreeing. She would have to trust that. She was running out of room to not trust things. The full file from Victoria arrived at her personal email at 7 that evening. Emma sat at her kitchen table and opened it, and for the next 3 hours she did the things she had done on Wednesday in the simulation lab. She let herself be fully Emma. Crease, fully present, fully the physician. She was reading a complex case with the totality of everything she knew. Senator Edmund Hale's heart was in worse shape than even Victoria's careful summary had suggested. The bicuspid valve was severely degenerated. The aortic root involvement was significant, as Emma had suspected from the partial data, a dilation that the primary surgical team had noted, but had not, in her assessment, fully weighted in their approach plan. Post-stroke, the risk profile was genuinely complex. He was not by the numbers an easy save. He was not impossible either. She pulled up the surgical atlas, worked through the anatomy, thought about approach it about the modifications that would address what the primary team's plan didn't. Built in the space of 3 hours in a pot of tea, she didn't drink an alternative surgical framework that was more aggressive in the root repair and more conservative in the clotting management, a balance that accounted for his post-stroke anticoagulation needs in a way the current plan didn't adequately handle. At 10 o'clock, she sat back and looked at what she had built and felt something she had not felt in a very long time, the clean, precise satisfaction of a difficult problem, yielding to the right combination of knowledge and judgment and care. She thought about Edmund Hale, the man who had stood at a press conference with grief on his face and calculation in his eyes and let a 28-year-old surgeon absorb the weight of a mistake he had engineered. She tried to locate hatred for him and found with some surprise that it wasn't where she'd left it. 6 years ago, it had been enormous, a consuming, clarifying fury that had kept her moving when moving was the only alternative to stopping entirely. Now it was something smaller and more complicated. A scar, still there, still real, but no longer the loudest thing in the room. What was louder was the image of his file, his heart, the specific, correctable, treatable problem that was going to kill him if no one with the right knowledge intervened. She knew how to fix it. That was the simple, terrible, clarifying fact at the end of 3 hours of analysis. She knew exactly how to fix it, and she was going to have to decide what to do with that knowledge. And she already knew, had probably already known since Victoria walked through her door, what the decision was going to be. She closed the atlas, went to bed, lay in the dark with the ceiling above her, and thought about the oath she had taken at 25 years old in a room full of people who were becoming doctors together, who had said the same words at the same time and meant them, with the uncomplicated conviction of people who hadn't yet discovered how complicated the world intended to make the keeping of them. First, do no harm. She had kept it in a trauma bay with a bleeding man in 3 seconds and hands that remembered. She had kept it in a simulation lab with a synthetic aorta and 6 years of buried knowledge brought back to the surface. She had kept it quietly and perfectly in 6 years of nursing that she had never let herself call a consolation prize, because it wasn't, it was the oath expressed differently, at a different scale in the only room the world had left her. She was going to keep it Friday. And after Friday, if there was an after Friday that didn't involve the complete dismantling of everything she had built, she was going to have to decide what to do about Edmund Hale. She already knew that too. Her phone buzzed. A text from an unknown number that resolved as she read it into someone she had not expected. Calloway. I know I said I'd let it go. I can't. I've seen 2 attendings operate in 4 years of residency. I've never seen hands like yours. I don't know what happened to you or why you're here, but I think the hospital should know what it has. I think you should have your room back, whatever that means. I don't know how to help, but I wanted you to know that I see it soon. Calloway. Emma read it twice. She sat up in bed with her phone in both hands, in the particular feeling of a person who has been running so long that the sudden absence of forward motion is itself disorienting. When you stop running, you have to stand somewhere, and standing requires a different kind of balance. She typed back slowly, "Thank you. Don't do anything yet, please. 5 more days, then we'll see what's possible." She put the phone down, closed her eyes. 5 days, Ahern, then Hale. Then what? She didn't know. She had not let herself know. But whatever it was coming with the inevitability of something that has been in motion for a longer time and is only now arriving close enough to see clearly. Her hands were steady in the dark. The surgeon was awake. And somewhere in the hospital, Robert Ahern's aneurysm was doing what aneurysms do, waiting with perfect patience for a clock to run out. She wasn't going to let it. Friday arrived at 5:47 a.m. in the form of an alarm Emma had set but didn't need. She was already awake, had been awake since 4, lying in the particular stillness of someone who has finished making a decision and is now simply waiting for the world to catch up to it. She dressed in the dark by habit scrubs, shoes tied with the automatic precision of 1,000 previous mornings, and stood at her kitchen window for exactly 1 minute, drinking coffee she actually tasted this time, watching the city exist in its pre-dawn state of almost quiet. 5 days ago, she had been Anna Hayes fully and without visible seams. This morning, she was something in between. Not yet Emma Cross, not entirely Anna Hayes, but the specific, unsteady, clarifying thing that happens in the space between who you were and who you are becoming when the distance between those two people suddenly collapses to nothing. She drove to Mercy General in silence. No music, no radio, just the road and her own breathing and the inventory she had been running in her head since Wednesday, every step of the procedure, every contingency, every decision point, where the next move would need to be made faster than conscious thought and would therefore need to already live somewhere deeper than thought. It lived there. She had put it there. She was ready. She entered through the main entrance at 6:15, badge swiped, unremarkable. Anna Hayes, night shift nurse, arriving early. She went to the locker room, changed into fresh scrubs, and was heading toward the OR corridor when Reed found her at the intersection near the surgical prep area. He looked like he hadn't slept either. His eyes carried the specific weight of a man who has been holding an enormous secret at altitude for a long time and is now very close to either landing or running out of fuel. Petrov is already in, Reed said quietly, falling into step beside her. Team arrives at 6:45. Patient is being prepped now. His pre-op vitals. Stable, better than projected, actually. He had a good night. Good. Emma kept walking. When we're in the room, I need you at the field, not directing, present. If anything happens that requires your credential in that room, you respond. But the procedure is mine. Agreed. And Reed. She stopped walking, turned to face him. Your hands. If at any point you feel the tremor engage, tell me immediately. Don't manage it. Don't compensate. Tell me. He held her gaze. Something moved across his face that was not quite humility, but was in the neighborhood of it, the expression of a man who has spent decades being the most capable person in any room and is now standing beside someone who surpasses him and has chosen consciously to not look away from that. Understood, he said. They walked the rest of the way in silence. Petrov was at the anesthesia station when they ordered a compact, unhurried man in his 50s, whose reputation for composure was Emma assessed in 30 seconds of observation completely accurate. He looked up when she came in, and his expression did exactly nothing dramatic, which was the most reassuring thing that had happened to her all morning. Dr. Cross, he said quietly. Not Anna Hayes, not nurse, just the name and the title offered like a fact. Dr. Petrov, she said, I've reviewed the case. He returned to his preparation. I'll manage the anticoagulation protocol you'll need for the cross-clamp window. I've adjusted the baseline from what the original plan specified. The root involvement warrants a tighter margin. She stopped, looked at him. You reviewed the root imaging independently. I did. He didn't look up. I don't put patients under for surgeries I haven't fully understood. Whoever is operating. A pause. The modified approach you'll be using is correct. The primary team's plan had a gap. You saw it. Emma stared at him for a moment. Reed told you the approach? Reed told me the basics. I read the rest. He finally looked up. I've been practicing anesthesiology for 26 years. I have seen brilliant surgeons and I have seen adequate ones. I know the difference before the first incision. I am not concerned about this morning. He held her gaze. Are you? The honest answer was yes, in the way that anyone who understands what they're about to do is always concerned. The answer she gave him was no. He nodded, went back to work. The team arrived at 6:42. A scrub tech named Marcus, efficient and unreadable. The first assist, Dr. Nina Falco, third-year resident Reed's most technically gifted, who took her position without apparent confusion about the configuration of the room. Reed had clearly spoken to her. Her eyes found Emma's once briefly and then went to the field professional and focused and stayed there. Robert Ahern was wheeled in at 6:58. He was awake, sedation hadn't fully taken hold yet, and his eyes found the room with the searching, slightly unfocused quality of a person trying to locate something solid to hold on to. Emma was beside the table when his gaze landed on her. Hey, she said. Quiet. The same words she had said to Daniel Marsh 10 days ago in Bay 4 before everything changed. Hey, he said back. His voice was rough with nerves and whatever the pre-op medication was doing to the edges of his consciousness. You're the nurse. I'm going to be with you the whole time, she said. True technically, the truest version of what she was allowed to say. You're going to be fine. My wife, he stopped, swallowed. She's out there. She's in the family room. She'll be the first person you see when you wake up. Something in his face settled. Not all the way you don't fully settle when you're about to have your chest opened, but enough. The particular human thing of knowing that someone specific is waiting for you on the other side of something frightening. The anchor. Okay, he said. Okay. Petrov administered the induction. Ahern was under in 40 seconds. And Emma Cross, for the first time in 6 years, stood at an operating table with a patient before her, and a room of people around her, and instruments in her hands, and did the thing she was made to do. The first incision was exact. She felt it, the profound and settling rightness of it, and set the feeling aside immediately because this was not the time for feeling. This was the time for doing. Cross clamp ready, Petrov said at the 17-minute mark. On my mark, Emma said. Her voice in the OR was different from her voice anywhere else. Not louder, not harder, just clear. The voice of someone who has found the frequency at which they operate best and is transmitting on it without interference. Mark! The clamp engaged. The clock started. She worked. Reed was at the field, present, his gloved hands positioned, but still performing the visual fiction of the lead surgeon, while Emma's hands moved with a precision that had spent 2 days relearning itself in a simulation lab and 6 years not forgetting. 7 minutes in the root involvement revealed itself exactly as she had anticipated. Worse than the primary team had accounted for, better than the worst-case scenario she had prepared for. The gap in the original surgical plan opened in front of her like a door that had always been there, and she walked through it without breaking pace, modifying the repair in real time with the particular fluid adaptation that Osei had spent 2 days stress testing and couldn't break. You're seeing the root, Reed said quietly, not directing, observing. I see it. She didn't look up. It's manageable. Adjusting the approach now. Falco beside her extended the correct instrument before Emma asked for it. Emma registered this, the small, significant thing of a good resident reading the field, and it kept moving. 12 minutes. 13. Emma, Petrov's voice even but carrying information. Pressure is drifting, not critical, trending down. I hear you. She didn't slow. 2 minutes. It at 15 minutes and 41 seconds from Cross. Clamp, she said, releasing. The clamp came off. The room held a breath that was also a prayer, and also just biology, the moment of reperfusion, when the heart that has been interrupted by human hands either resumes its own authority or doesn't. Robert Ahern's heart resumed its authority. The monitor confirmed it in the clean, rhythmic language of a body returning to itself. Pressure, stabilizing rate, settling the specific sound of a life, continuing, that never gets less significant no matter how many times you hear it. Marcus, the scrub tech, exhaled quietly through his nose. Falco's eyes above her mask had the bright quality of someone witnessing something that will live in their professional memory for the rest of their career. Reed said nothing. She could feel the quality of his silence, not empty, but full, of something that was not quite relief and not quite awe, but contained both. Closing, Emma said. She closed the way she had always closed, with the particular care of someone who believes that the last thing you do to a patient's body is as important as the first. 22 minutes later, Robert Ahern was intact, repaired, and being transferred to the care of a recovery team that would tell his wife in approximately 4 minutes that her husband had come through. Emma stepped back from the table. She stripped her gloves, set them down, and stood in the middle of the OR with both hands at her sides and breathed. Reed was beside her. Cross, he said quietly. I know, she said. She did know whatever came next. The immediate crisis was resolved, the man was alive, and the world was about to proceed into territory she had not fully mapped. The board, Reed said. I've been thinking. After today, not now, she said. Let me have 5 minutes. He gave her 5 minutes. She used them standing at the scrub sink, washing her hands with the deliberate, practiced motion of someone who understands both the clinical and the symbolic weight of the act. She looked at her hands under the running water. 6 years, 2 days in a simulation lab. One surgery that should not have been hers to perform and had been inescapably hers to perform. Osei had said, don't disappear again. Calloway had texted, I think the hospital should know what it has. Victoria Blackwood had said, you haven't stopped being a doctor, you've just been being one in a smaller room. And a 68-year-old retired teacher named Gerald had written in shaky cursive, You have a gift, Deanna. Don't waste it. She turned off the water, dried her hands. She walked out of the OR and found Reed in the corridor, and before she could speak, she saw Jenna. Jenna was standing 15 feet away with the expression of someone who was not supposed to be in this part of the hospital and knew it, and had come anyway because something had overridden the ought to of it. Her eyes went from Reed to Emma and back, and she was doing the addition with 22 years of expertise, and arriving Emma could see at the correct sum. Jenna, Emma said. The schedule said Reed was in OR3, Jenna said. Her voice was careful, not angry, the voice of a woman who wants to understand before she reacts. But I checked the board this morning and your name wasn't on it. And now you're coming out of OR3 and Reed is behind you and you look, she stopped. You look like yourself. For the first time since I've known you, you look completely like yourself. Emma looked at her, this woman who had shared a break room with her for 6 years and handed her coffee and read her correctly every single time and had the decency to not push until pushing was necessary. It's a long story, Emma said. I have time, Jenna said. Not here, Reed said. My office, all three of us. 20 minutes. Jenna looked at him, then at Emma. Then she said, was the patient in that OR safe? He's in recovery, Emma said. He's going to go home to his children. Jenna nodded once. Then we talk. She turned and walked toward Reed's office, like a woman who has decided that whatever she is walking toward it squarely, and Emma felt something loosen in her chest that had been held tight for so long she had stopped noticing the tension. In Reed's office, Emma talked. All of it. Not the carefully parceled, strategically shaped version, the full version. Her real name, the fellowship, the surgery, the senator, the investigation, the decision to disappear, 6 years of Anna Hayes, the femoral repair in Bay 4, Reed's office that night, the simulation lab, this morning, every piece laid out in order without apology and without performance. Jenna listened without interrupting. Her face went through several things, shock, anger, a particular grief, and then something resolving at the end into the expression of a woman who is furious at a system and not at the person sitting across from her. When Emma finished, Jenna said 6 years. Yes, you've been here 6 years. She said it like she was computing the distance. And every night we worked together, the patients you covered, the calls you made, the things you caught that other nurses missed. I was doing my job, Emma said. You were doing two hours, Jenna said with a quiet intensity. You were doing mine, and you were doing the one they took from you, and you never said a word. The silence that followed was not empty. It was the specific fullness of a truth that has been told and after a long time and is now occupying the space it was always meant to occupy. Reed said, I've spoken to the hospital's legal counsel informally. The pathway to reinstating a suspended medical license under the circumstances Emma has described, circumstances which I am prepared to document in full and submit officially, is not simple, but it exists. He looked at Emma. It requires Emma to petition for review. It requires supporting documentation. It will take time and it will not be without exposure. He paused. But it is possible. Emma looked at him. And your hands, the board, Reed held her gaze. I've scheduled my own medical review. Next week, I'm disclosing the tremor. He said it with the steadiness of a man who has made a decision that will cost him something and has made peace with the cost. I've been the best surgeon in this room for 20 years. I'm not going to let the disease I can't control become a patient risk I refuse to manage. That's not who I am. A pause. I should have made this decision months ago. Emma looked at him for a moment. At the complexity of this man, his calculation, his need, the way he had used her, and the way he had also, in the same motion, offered her the only door she'd had access to in 6 years. People are rarely one thing cleanly. You saved my life, she said. In a roundabout, ethically complicated, completely questionable way, you gave me my hands back. She paused. I'm not thanking you for the leverage. I am telling you that the outcome mattered. I know, Reed said, and he meant it. The petition for license review was filed 11 days later with Reed's statement attached and Osei's professional testimony in a documentation package that Emma's newly retained attorney described as unusually thorough for someone who supposedly disappeared. The review board scheduled a hearing for 8 weeks out. Emma sent Victoria Blackwood the alternative surgical framework for her father's case the morning after Ahern's surgery, a complete annotated plan addressed to the primary surgical team as an anonymous second opinion through a channel Victoria had arranged. She did not perform the surgery herself. She was not yet in a position to. But the team adopted 3 of her 4 recommended modifications, and Edmund Hale's surgery performed 12 days later by the primary team with the adjusted approach was successful. She did not know how she felt about that. She suspected she would be working out how she felt about it for a long time. What she knew was that she had looked at the file of a man who had damaged her life, and she had applied everything she knew to the problem of how to save him, and she had done it because the alternative, deciding that the oath had exceptions, was not something Emma Cross was capable of. Not in a trauma bay, not in an OR, not anywhere. She did not forgive Edmund Hale. She also did not let him die. These 2 facts existed simultaneously in her without resolving, because some things are not meant to resolve. They are meant to be held steadily with both hands for as long as it takes. On a Tuesday morning in the 8th week, Emma Cross sat in a review board hearing room and answered questions for 2.5 hours. She answered them directly without deflection, and when the board asked her why, given what she had experienced, she had remained in medicine at all, she said, "Because I could not stop. Because the work was never the thing that failed me. The people around the work failed me. And eventually I understood that those are different things and that one of them was worth coming back to." The board deliberated for 4 days. On the 5th one, Emma's phone rang at 8:14 in the morning. Her attorney. 2 sentences. She sat down on the edge of her bed and held the phone in both hands and let the 2 sentences be real. License reinstated. Conditions minimal and standard. She called Osei first. Osei said, "I know my contact on the board texted me," and Emma could hear across the phone that Osei was crying, which set off a corresponding response in Emma that she did not fight because there was no longer any reason to. She called Jenna second. Jenna said, "When do you start?" And Emma laughed, actually laughed the full and uncurated kind, and said, "I'm working on it." She did not call Reed. She texted him a single word, "reinstated." He responded with 3, "Knew you would," which was not entirely true, but was the kind of thing people say when the outcome they hope for has arrived and accuracy feels less important than celebration, and she let him have it. On her last shift as a nurse at Mercy, General Yoon found her in the corridor near the end of the night. She had clearly heard. The department had clearly heard it had been a week since the news moved through the hospital. The way news moves through hospitals, which is to say completely and immediately, and with the particular quality of a story that people recognize as significant even before they have all the facts. "Dr. Cross," Yoon said, trying the title out. It fit. "Still Anna for another 6 hours, Emma said. "Then we'll see." "When you have your own OR," Yoon said carefully, "and when you're looking for a resident." She stopped, looked slightly mortified by her own directness. "Sorry, that was too much." "It wasn't," Emma said. "I'll remember." She finished the shift. She handed in her badge. She said goodbye to Jenna, which took longer than expected because Jenna had things to say, and the decency to finally say them, and Emma stood there and received them the way she had been learning slowly to receive things, without deflecting, without minimizing, without the reflexive protection of a woman who has spent 6 years making herself small enough to be safe. She walked out of Mercy General at 7 in the morning into a day that was doing the unreasonable, luminous thing that important days sometimes do. She stood on the sidewalk with her bag over one shoulder and her hands at her sides, and the specific feeling of a woman who has come to the end of a very long road and is now standing at the beginning of a different one. She was not unbroken. She had never been the kind of person who pretended that survival was the same as arriving intact, or that the things that happen to you leave you unchanged, or that a reinstated license restores the 6 years it took to get here. She was marked by what had happened. She would always be, but her hands were steady. Her mind was clear. The oath she had taken at 25 was the same oath she would carry into whatever room came next. And the surgeon who had been told 6 years ago that she was finished, the one who had rebuilt herself in a smaller room and kept her hands sharp and kept her patient safe and kept her promise to the work even when the work could not openly claim her, that surgeon was still here. She had always been here. Emma Cross picked up her phone and called the hospital affiliated with the University Medical Center, where Osei worked. She had spoken to the chair of cardiovascular surgery twice in the past 3 weeks. The conversation she was about to have was not unexpected on either end. "This is Dr. Emma Cross," she said. "I'm ready to discuss the position." And she was.